My name is Sherry Scraber, and this is my debate video number 1 on physician-assisted suicide. I am against this topic. First, I will provide some facts on what physician-assisted suicide is, in case you are unaware. According to the AMA, American Medical Association, physician-assisted suicide occurs when a physician facilitates a patient's death by providing the necessary means and/or information to enable the patient to perform life-ending act. For example, the physician provides sleeping pills and information about the lethal dose while aware that the patient may commit suicide. Physician-assisted suicide is legal in 9 U.S. states and the District of Columbia. It is an option given to individuals by law in the District of Columbia, Hawaii, Maine, New Jersey, Oregon, Vermont, and Washington. It is an option given to individuals in Montana and California via court decision only. In other words, if you live in Montana or California and you want to participate in physician-assisted suicide, you have to go to court and lobby why you think that this should be able for you, and have a physician also that's willing to do that for you. There are 2 means of passing under medical care, I guess you could say, that kind of get confused. I'm focusing on physician-assisted suicide, but there's also euthanasia. A doctor is allowed to, by law, to end in euthanasia, I guess. A doctor is allowed by law to end a person's life by a painless means, as long as the patient and their family agree. In physician-assisted suicide, a doctor assists a patient to commit suicide if they request it. So in euthanasia, a patient has an IV. The physician administers a medication in a lethal dose that he knows will make the patient pass away. In assisted suicide, the physician prescribes the medication, and the patient actually administers the medication on their own. That is the difference in it. As I mentioned earlier, I am strongly against physician-assisted suicide. I have been a nurse for 6 years. I think that plays a huge part, other than religion. So physician-assisted suicide breaks multiple codes of medical ethics. Physician-assisted suicide is fundamentally incompatible with the physician's role as a healer and would be difficult or impossible to control and would pose serious societal risk. For my example earlier, the physician prescribed sleeping medication and the patient administered that himself. There's no saying how you're going to pass. I think a lot of reasons why people choose this physician-assisted suicide is because they want control over how and when and all of the reasons why they're going to die. And there's no saying how your body's going to metabolate a medication. There is no saying that this medication will do what you're wanting it and how you're wanting it to do. There's still so many unknowns. So control isn't an appropriate reason. Instead of engaging in assisted suicide, physicians must aggressively respond to the needs of patients at the end of life. Physicians should not abandon a patient once it is determined that the cure is impossible, must respect patient autonomy, must provide good communication and emotional support, and must provide appropriate comfort care and adequate pain control. I believe that when care is appropriately withdrawn, the course of terminal illness is the cause of death. If a medication is prescribed to cause the death, the prescription is the cause of death. In the case of a terminally ill person's, appropriate withdrawal of care is openly and widely used in the United States without a need for physician-assisted suicide. Medical care can always be declined. As a nurse, I see this all the time. A patient wakes up in the morning and they don't want their blood pressure medicine, or they go to bed at night and they don't want their sleeping pill. Patients have the right to that. They have the right to know what medication they're taking, why they're taking it, and do they want to take it or not. And I am 100% for that. If a patient knows their diagnosis and knows their terminal and says, I don't want to try and cure this anymore, I want to die peacefully, and that is where hospice care comes in. And that is the most ethical way, I believe, to pass medically. As I said before, physician-assisted suicide, patients can also always simply refuse further medical care. There is excellent terminal care in the form of hospice that is widely used in the United States. Virtually every person in every county in every state has access to hospice care if and when they need it. This is true for old and young, rich or poor, cancer or non-cancer. A significant fraction of people who die in the United States are under hospice care. It is not the case that the healthcare system in the United States is unable or unwilling to care for the terminally ill. The compassion arguments for physician-assisted suicide fall short because quality medical care to relieve suffering for the terminally ill is readily available and widely used. I have had multiple family members and patients that have used hospice care. I have followed a hospice nurse multiple times. I've even thought about going into hospice care. It is just, as I mentioned earlier, the most ethical way to pass while you're under medical care. Those nurses and physicians are there to make passing as pain-free and keep yourself a dignity as much as possible. That is their job, and they're very good at it. As I mentioned earlier, simply the desire for control over timing and circumstances of death is not a sufficient reason to pass legalization for physician-assisted suicide. Recently in the news, most of you have seen that a young woman was convicted for coercing her boyfriend into suicide. I believe she was texting him while he was in his car, telling him, "You can't get out. This is what you want to do." She was telling him that this is what you want to do this whole time. This is what you need to do. But how is this any different than a physician-assisted suicide? This young woman did not actually murder anyone. All she did was convince her boyfriend that suicide was actually what he wanted to do. Physicians promise to provide adequate medical care. Allowing and educating a patient on suicide makes the physician no better than the young woman. Physicians know how to make you better. And if they don't know how to make you better, they know how to make you more comfortable and turn you over to hospice care. So telling a patient this is how you should kill yourself, same thing as that young woman. And she was convicted. As I mentioned earlier, I'm a nurse, and so I have to present what the American Nurses Association agrees on it. Nurses need to reflect on their own belief systems and end-of-life options. The ANA provided a statement on physician-assisted suicide that prohibits nurses' participation in assisted suicide and euthanasia. The ANA recently revised their nursing code of ethics, stating that nurses should assist patients with end-of-life planning and provide interventions to relieve pain and other symptoms in the dying patient consistent with palliative care practice standards. The American Nurses Association also agrees palliative care is the best option. The ANA specifically states that nurses are ethically prohibited from administering medical aid and dying medication. Yet they must be comfortable supporting patients with end-of-life conversations, assessing the context of medical aid and dying request, for example, concern about treatable depression or coercion, advocating optimized palliative and hospice care services, and knowing about aid and dying laws and how those affect practice. Nurses should reflect on personal values related to medical aid and dying and be aware of how those values inform one's ability to provide objective information in response to a patient's request. So yes, I am a nurse, but I don't believe that my stance is only for nurses. Everyone has family members, friends, and we are all going to die one day. This could definitely affect anyone. And physician-assisted suicide just isn't the way to go about that. Physicians are healers, and they're supposed to help you get better. And when they cannot, then they help you comfortable in passing. They do not help you pass away. They do not help you kill yourself. There are hospice options, palliative care options. Those are just statistically so much better, and this is why I'm against physician-assisted suicide.